In this episode of the Nurse Practitioner Podcast, Dr. Stephen A. Ferrara discusses influenza. What can you tell us about this year's flu season?
This year's flu season is already underway. Typically, we see a peak in flu season in the months of December to February, but it's still too early for us to know if it's going to peak at this time. So flu season is really year-round, and we don't necessarily think of it that way, but the CDC does record every week of influenza activity, and there is influenza activity consistently throughout the United States at any given time. What we typically refer to as the flu season is the time when the year's flu vaccination is being distributed, which is usually at the beginning of September, and the goal is to make sure that individuals get vaccinated. And that's really the most important mode that we're in right now, is making sure that the flu vaccine that is available finds its way to patients who need it.
What are the CDC's latest recommendations?
The CDC's latest recommendations is to vaccinate individuals by the end of October. And that is really the time when it's best to have individuals get the influenza vaccine. It does take our bodies about 10 to 14 days to actually build up immunity to the vaccine. Therefore, I always tell patients that once they're vaccinated with the flu vaccine, they're not immediately protected, and they need to sort of still exercise standard precautions as they should throughout the year whenever they come in contact with somebody who is ill, or if they themselves are feeling sick. It's certainly recommended that people who are sick should not interact with others that are sick and avoid if at all possible. So those are the main ideas about timing for the flu vaccine. And then there's also the idea of who should get the flu vaccine. So certainly there are high-risk individuals that should get the vaccine really first and foremost. And these tend to be individuals who have immune systems that have some compromise to it. So if they're on immunosuppressant medications, or if they have HIV or AIDS, those are individuals that certainly should get influenza vaccine, as well as anybody over age 65 should get flu vaccines. And then pregnant women, there's a number of high-risk people that we want to make sure gets that vaccine.
Is this different from last year?
The recommendations for who and the timing of vaccines are the same as last year. So it's easy for all of us to remember that the standards are the same, the recommendations are the same, and now is the time to vaccinate.
Are the strains the same?
The strains are actually different than the formulation from last year. So I'll give you an example. The 2019-2020 vaccination includes an H1N1 strain, and while the H1N1 strain was also in the flu vaccine last year, it's a different component of that H1N1. What's also been updated is the H3N2 vaccination component from the last year vaccine. And the hope is, of course, that these strains are better updated to what will be the circulating component that will be prevalent in this year's flu activity that's recorded. Regarding the B strains of influenza, they are exactly the same as the B strains from the 2018-2019 immunization vaccination that was given.
Are you seeing flu activity yet? If so, where is it most prevalent?
So as I mentioned earlier, there is flu activity year-round, but we are now into the 2019-2020 flu season. And with that, we are starting to see flu activity. Now, the CDC does record this activity, and it reports it every week. And I encourage everybody to visit the CDC's website at cdc.gov/flu. And they have wonderful tracking tools for influenza. And as of right now, flu activity is considered below the national baseline, and it is considered low. but we are constantly monitoring that and making sure that numbers don't rapidly creep up earlier than anticipated. So flu activity is low right now, and we're keeping a close eye on it. Believe it or not, Louisiana has reported regional activity that's higher than the rest of the country. We're also seeing some pockets in California and Nevada. So it's interesting to watch, but as of right now, generally speaking, flu activity is low.
What populations are at most risk of complications from the flu?
The populations at risk that we consider high risk would be the following: adults 65 years of age and older, pregnant women, young children, patients who have asthma, heart disease, or history of stroke, certainly patients who have diabetes. I mentioned earlier about patients with compromised immune systems, such as those with HIV, AIDS, cancer patients, and children with neurologic conditions are also at higher risk for influenza. The other thing that I'd like to mention is that there is a time of year that is called National Influenza Vaccination Week. This week will occur between December 1st and December 7th. And this is a time where we really encourage people to get vaccinated if they haven't done so already. This is right before what typically is peak flu season, and as we head into the traditional winter holidays when families will be together, we want to make sure that you're not sharing viruses and infection when families typically gather over the holidays. So December 1st to the 7th is National Influenza Week, and I certainly suggest and recommend that everybody receive a vaccine. To find where you can get the vaccination, you can go to the CDC website. They have a flu vaccine finder, and I encourage everyone to visit that site. But the great thing today is that most pharmacies and big box stores are even offering influenza vaccine that doesn't require an appointment and is really no wait. And what we really want to do is make sure that the vaccination is available to those who want it and need it. This year, influenza vaccination, it's approximated that 162 to 169 million doses are going to be distributed throughout the United States. So we definitely want to make sure that those doses don't go to waste. We anticipate that there will be enough supply to go around. And also for clinicians who are listening to this, there are a number of different influenza preparations. And while all the influenza vaccines contain the same components, we now have vaccines that are prepared differently. So for patients who have had severe egg allergies, there's an alternative for that. What's also back is the live virus vaccination that is in the form of a nasal vaccine, and certain patients can get that. It's recommended for certain patients and not all patients, and certainly patients who don't have a compromised immune system, they should not get the live virus vaccine. But that's an alternative to the traditional shot that's out there. And the last thing I want to mention is influenza treatment. There are 6 medications that are FDA approved for patients who have influenza. What we try to make sure everybody understands is that we don't wait until somebody is diagnosed with influenza before starting to treat them. So in other words, if we as clinicians suspect influenza-like illness, we would start treating patients right away, because these medications, they're most effective when given within the first 48 hours. Sometimes it could take a while for influenza cultures to come back, and somebody may wait a few days before visiting their nurse practitioner or physician assistant. So the idea is we have these medications, and those high-risk patients that I just mentioned, those are the individuals that should get treated for influenza with these medications. Of course, medications have side effects. And as clinicians, we always weigh the risk versus the benefit of starting to treat somebody for any condition. But certainly we worry that influenza can lead to possible super infection. So somebody could get pneumonia on top of influenza, and certainly those patients are at very, very high risk for negative outcomes. The last thing I'll mention is that influenza every year in the United States kills approximately 60 to 70,000 people. That's a huge number. Some years are certainly worse than others, but it is not something to be taken lightly. And the best tool we have is to prevent influenza by vaccination, and also with common sense infection precaution, washing hands, throwing away used tissues, coughing into your arm, wearing masks as necessary. But again, the number one way is for everyone to get vaccinated.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.